My name is Rashmi Halker Singh. I'm the Deputy Editor of Headache. I'm joined today by Dr. Fred Cohen, who recently wrote a paper entitled The Role of Artificial Intelligence in Headache Medicine, Potential and Peril. Welcome, Dr. Cohen. Can
Thank
you
you. Happy to be here.
can you tell us about this really interesting piece?
Sure. So I wrote an opinion piece about the use of artificial intelligence and with headache medicine. For artificial intelligence, while that concept has been around for quite some time, it's been getting stirred up a lot with the recent use of AI models like ChatGPT. AI has been used in headache medicine quite a bit in the past several years, such as there was a study last year that used AI looking at EKGs of patients with migraine with aura and trying to catch atrial fibrillation. That paper actually won the early career award. So that was a major study that came out. And there were slightly even years, I believe, more years before that was looking at a computer engine model trying to help triage and diagnose migraine. So the uses have been there, but sort of what we've been seeing towards the end of 2022 into 2023 is, the media is ablaze with ChatGPT. Um, and that got to me thinking like, all right, well, how can this be sort of used in the world of headache medicine? How can things like this model be utilized? What good can come from it, but also is there potential worry or potential like bad outcomes?
Oh yeah, I mean we hear about this in the popular media all the time. The other month, my daughter's school sent all of us parents a note saying ChatGPT cannot be used to write essays in school. I was telling you that my husband used ChatGPT to write me a love letter as a joke the other month. There are lots of ways that people use this in real life. What do you think are some of the clinical, I guess, positives that you think we can use this as a headache medicine clinician?
So for the use of headache medicine, what I explore is there's a lot of there's a lot of options. It's sort of limitless. It's as you see fit. As you were saying, the wide uses. I've in the literature we've seen that, well, just like you said with schoolwork, there's reports of using it for assignments. Someone has already had ChatGPT pass all the steps of the USMLE and the bar exam. So it's doing these complex things. Various medical societies are actually implementing rules about using AI models like this because there's already papers coming out with ChatGPT listed as an author that they've tried to utilize it to write these studies and even interpret studies. There was a study that was done that I mentioned in the paper where a group took 50 abstracts from JAMA, Lancet, New England Journal of Medicine. They put it into ChatGPT and they said, come up with 50 fake abstracts. They did that. They actually had to go against a plagiarism checker, an AI detector, an actual scientist. It got through the plagiarism checker, just fine. It sort of got through the AI detector and actually fooled some of the scientists. So it's creeping in anywhere. In the field of headache medicine, I think there's a lot of potential where it could be used to assist with things like triage. Like if it could be set up in a way where someone describes the symptoms and it's like, oh, this is, what, a primary care doctor can handle this, or maybe a general neurologist. This needs to go to a headache specialist, or this should go to an emergency room. Perhaps it could help with automating and speeding up things like prior authorization and getting help getting medications approved, things that usually could bog a clinician down or require the ancillary staff to assist. It could free them up to do other patient-related tasks.
Oh, yeah. I mean, that's what we see as being a big source of burnout, right? All these administrative tasks, prior authorizations. Actually, you're right. Someone actually recently told me they used ChatGPT to write a prior authorization letter or an appeal
That's what I
letter.
do myself.
That's amazing.
I've already utilized it to write from CGRP monoclonal antibodies, Botox, that it could help be used to make a template and whatnot. And when I say all this, I do want to state, I don't advocate putting something in the chat GPT and simply taking it out to, of course, proofread it and not just straight copy it. But yes, using all those things like that I've already done in my practice and has definitely helped speed up this process and focus on more patient driven tasks.
So there are definitely some positives. Do you see any concerns with using these artificial intelligence modules such as ChatGPT or others?
Definitely. And just to mention on that, while we are mentioning ChatGPT a lot, there are other models coming out. I'm not sponsored by ChatGPT, although I think that'd be really cool if I was. Hey, OpenAI. But Doximity has released their own model too. There's word that Facebook is releasing a model as well. And just to quickly explain what these are, essentially, this is a model that you are able to put in text and it's able to generate a human response. And then, that's what makes it different from just putting something into Google search. But with that said, when you put something in, you're not getting references, you're not giving citations. It doesn't say where it's getting the information from. So you can't per se proofread it, you can't check it. There's no way to 100% know is what it's saying is authentically correct. The example I gave in my paper is I asked ChatGPT, I directed it to write a manuscript about the epidemiology of migraine in penguins. And it actually churned out this quick little paper. It gave it a great title. It gave it the title migraine. It was Migraine Under the Ice, Understanding Headaches and Antarctica's Feathered Friends, which is a great title. Like, it's a fantastic title. It began to go on about how migraine is more prevalent in male penguins and female penguins. At the age of onset is 4 years old, that emperor and king penguins get migraine more often than other species. I did a PubMed search to see if anyone's did this. Nothing came up. This information, where did it come from? Which makes me speculate that the AI model was extrapolating and trying to come up with something, and it got through. And it's a prime example of, you can't just take everything that's coming out right now as gospel, as 100% truthful, which is why I was stressing before, if you do use this, don't strictly copy it, read it. You don't want to give the bad information to a patient and give something that's not true.
Yeah, absolutely. Well, I think this is really fascinating information. I think there's probably a lot more to come. Do you have any final thoughts for us?
I would say, those who haven't checked it out, check it out. The uses are pretty cool. But, again, as I stated in my title, there's a lot of potential, but also peril, like cautious. Like, I don't want to come off and says like, everybody get on board and use this, and, it should be implemented immediately. No, it has its uses, but there needs to be caution. And it's better to go about it with an open mind, but also, hey, this is, not the way we should strictly practice medicine.
Awesome. Well, thank you so much for speaking with me today, and thanks for your work on this important topic.
Thank you.